Hi, welcome to Detours Understanding Acquired Brain Injury. And this is part of our continuing series, Essentials of Acquired Brain Injury. And we're talking about metabolic encephalopathy this time. So what metabolic encephalopathy is, it's part of what neurologists group together with toxic encephalopathy. Now, we've separated that out because we felt it deserved more of a focus, and so did this topic. Now, metabolic encephalopathy is more of a form of acquired brain injury. It's non-traumatic again, where there's either a problem with a person's organ systems, whether it's a genetic disorder or whether it is due to infection, disease, whatever, or whether there is a problem of nutrition or a vitamin or mineral deficiency, a problem on the cellular level or tissue or all the way up to organ system, but it is an intrinsic problem to the individual. This isn't something extrinsic. It isn't an infection necessarily or, something like that. It isn't a blow, or it is a malfunction of the body that does damage to the brain. And one of the challenges in diagnostics is it can be slow and insidious. So changes are less obvious until there is damage done to the brain. Now, the good news is some of these, because they're more chemical in nature, because it is a change in neurotransmission or the environment of the brain, there are things that can be done. And if you treat the primary cause, if you treat the organ problem, or if you replace what's missing, these can be reversed. Now, some can't because there may be structural damage by the time it's discovered. However, if it's detected, they can be reversed. So we'll be discussing some of the different metabolic problems here, looking at specific symptoms, but generally this will be just like all the rest in the series, quick overview, and then we'll talk about specifics in the future. So let's get into this. So any kind of change in chemistry of the brain, obviously, whatever the cause, would typically present with potentially coma or a altered state of consciousness. And this could come on quickly, especially for something like since the brain consumes about 20% of the glucose and the oxygen that the body consumes. As I've said, it's considered hypoglycemia. So if a person is diabetic and uses insulin, or if there's inadequate nutrition and you're in a hypoglycemic or low blood sugar state, you can become unconscious. And this can be life-threatening because your brain cells can't go for long without sugar. They do not keep or retain blood sugar. They don't have stores of energy. So this is one of the cases where a metabolic disorder can be rapidly fatal. This is why it's important to balance blood sugar, and why it's important to know if you're taking insulin or anti-diabetic drugs, it's important to know and to be able to have an emergency supply or a hyperglycemic drug on hand to treat it, just because this can be so dangerous. Exposure to other compounds can also disrupt the metabolic processes. We've talked about like heavy metal exposure and things like that when it was in toxic encephalopathy, but sometimes some vitamins and minerals are also dangerous in excess amounts or in inadequate amounts because it affects how the body processes and handles the synthesis of necessary enzymes that are needed to produce proteins and things that are needed for brain functioning. Certain fat-soluble vitamins can be lethal if they're in excess amounts or if they're not present. They form what are called coenzymes, which are parts of an enzyme necessary to help with production of proteins. But some of the most dangerous vitamins, A, D, E, and K, because they are fat soluble, and it's hard for the body to get rid of these. So what are clinical signs of primary clinical signs, let's call them, of the metabolic encephalopathies? I have notes here for this. Depression of awareness, so altered levels of consciousness, being kind of out of it or fully unconscious. So vitamin deficiencies can show up in this way. Problems with focus, another one. Problems with memory, another sign. Problems with organization thinking, executive symptoms. Problems with memory, that's a big one, especially when it comes to many of these vitamin-based deficiencies. You also will find other systemic effects and symptoms to look for. Here's a list of kind of symptoms from various vitamin mineral deficiencies. Generally, not just in the brain, but otherwise. It's just a quick list here. You also may find with some of the metabolic encephalopathies some kind of motor deficits, problems with coordination. A lot of these affect the liver. You may get what's called a flapping tremor, asterixis. You also see this in alcohol misuse. The reason you get this one is because there's usually vitamin or mineral deficiencies there. Thiamine, the B vitamin, deficiencies, and it has to do with coordinating motor function. As metabolic deficiencies progress, you also will find that there are problems in the deeper brain, the reticular activating system, which, as we've talked about before, when we talked about comas and altered levels of consciousness, we've addressed the fact that if there's damage here, you may have abnormal respiratory patterns or even respiratory and cardiac arrest. This is one of the ways in which they kill. You may present with what's called Cheyne-Stokes respirations due to extreme this is obviously extreme, just like asterixis and motor discoordination. Signs of, and you'd be looking for other symptoms for deficiencies, because when you're talking about vitamin mineral deficiencies, it shows in other ways, like, for example, calcium, potassium, things like that. You'll notice significant other symptoms. This is a major miss if your physician or provider, if you're seeing one, misses these kind of things. And hopefully blood tests would have revealed these, but this can happen, especially if you're dealing with other medical conditions, or if you're fighting alcohol addiction, drug addiction, things like that. However, these kind of various metabolic insufficiencies can affect, obviously, then your breathing. Cheyne-Stokes is an increase in respiratory rate, then a decrease. To standstill, then an increase, then a decrease. And it's indicative that cortical control and higher level control absent. And so there's this cycling. Here's what this pattern is like. Now, Cheyne-Stokes is a pattern that you see in also traumatic brain injury, when you have brain swelling too. So it's kind of a red flag. that there is a significant problem. Okay. Something that's important to consider, a lot of elderly and people who have GI problems are at increased risk. Clearly, those with liver failure or kidney failure from many different causes are at risk. Because they have problems absorbing, excreting excess amounts. And so it's more a matter of being aware of the symptoms of disorders of these organs, because a lot of the symptoms are more generalized in the brain, and they only become a permanent problem if left go, which is why people who have these symptoms, a lot of the brain symptoms that come from these look like many other problems, because they look kind of like what you see from hypoxic ischemic deficits, or they look like some of the chemical and deficits from the chemical and toxic. But they're the same kind of groups of problems. Changes in cognition, changes in processing speed, problems in memory. And so metabolic deficits become more a question of rule out everything else, as well as look for bodily dysfunction, look for organ failures, and test chemistry. Clearly, it requires a physician that is knowledgeable in these specific domains. So, unfortunately, it does require a lot more of a detailed workup in order to say much. And so this is kind of more scattershot. It's how to put it. You can't quite be as specific. So whether the problems, hypoglycemia is easy to describe, because usually if it affects your brain, you're pretty much unconscious. Hypoxia, that's something else we already discussed. Liver and kidney tend to be slower, and there are much more critical signs that you'll notice before then. Vitamin or mineral deficiencies, you'll have problems with your bones, you'll have problems with certain motor activities, which will show up long before then, or you'll have dermal problems, skin problems. And so there are a lot of other things that are noticeable. Now, toxicity, ammonia, can lead to, if it's elevated quickly due to liver failure, which is common, hyperammoniaism, forgive me pronunciation, but if your ammonia levels from liver failure, cirrhosis or fatty liver or whatever else, that can present as confusion, aggression, very much a unique set of symptoms, restlessness, delirious state. But usually a person who presents with this is pretty far gone with their liver disease. And again, has been seen by a hepatologist, a liver doctor, or has been seen by a GI physician. And usually it's at a point where you're in trouble, where you're facing mortality by that point. Kidney, if you're having uremia, you already are showing things like uremic frost, that white flakiness. And if your levels of, any of levels of nitrogen or those of the waste products are higher, your levels of sodium are really high, again, you're going to have other symptoms. And, if sodium is high, potassium is high, you're going to have cardiac issues, which, again, are much more imminently threatening. And this is why discussing this one is kind of more challenging. Now, something to touch on and why it is toxic metabolic encephalopathy, TME, is because a lot of pharmaceuticals, not just street agents, but pharmaceuticals, can affect your brain's chemistry. And that I want to talk about as a different episode, something completely separate, because I feel that we really do need to dive into the damage that medications could do. And we do, again, have a separate episode kind of devoted to that, but something more in depth at a later point. So that's pretty much this episode. Sorry it isn't like as developed, but part of the problem is due to the fact that the injury that you can get can be treated pretty straightforward if you put a patient on dialysis, if you use liver dialysis machines. I mean, here's some of the different devices. If you can get their chemistry back, if you use chelation therapy, it really does have a purpose. Chelation can be used to remove metals from the body. You can help kind of get a patient back online again. If you treat, through dialysis, kidneys, if you use liver dialysis, you could treat symptoms from the cognitive symptoms from transplants, of course. So by treating the primary medical condition, you can make brain injury symptoms go away, unless it's really advanced, in which case the patient's likely going to die anyway. And I'm not saying the brain injury isn't important, but what I am saying is usually there are much more imminent things that they're facing. So, and these kind of disorders are fairly rare. We're going to, in the next episode, get into very rare kind of stuff. Environmentally based acquired brain injury, which definitely can do structural damage, but are extremely infrequent. These are infrequent. Those are really infrequent. So if you have any questions, comments, anything like this, and as I said, we will talk about specifics later. But I wanted to just give you a quick overview of this kind of thing, because these are unusual and really reflect a derangement of body systems or cells. The next things we're going to be looking at are how environmental factors or exposure to forces and conditions in the environment can cause acquired brain injury, and that will be the last in this series. Then we'll start talking about individual specifics. All right, so please share, click, like, and subscribe. If you have any questions, please put them below. Remember that we have a Facebook page, and it's Friends with Brain Injury. Click like and subscribe. Don't forget the bell icon, and we will see you next time. Have a good day. Bye.